Concept of the day: contraindication and precaution in vaccination. Contraindications and precautions are conditions under which vaccines should not be administered. Acute, moderate, or severe illness with or without temperature elevation is a precaution for any vaccination because it is often not possible to differentiate between symptoms of the disease and adverse effects due to vaccination. Also, adverse effects worsen the course of the disease, should they occur. In contrast, acute mild illness with or without temperature elevation is not considered to be a precaution, and vaccines can be safely and efficaciously given to patients presenting with such illnesses. Patients with moderate or severe acute illness should be vaccinated as soon as their conditions improve. Now, question of the day: a 6-year-old girl presents to the clinic for a general checkup before her last scheduled DTaP vaccination. Her mother is concerned about mild swelling and redness at the injection site after her daughter's previous DTaP administration. The patient has mild spastic cerebral palsy. She was diagnosed with epilepsy at the age of 5 that is well controlled with levetiracetam. She is allergic to penicillin. Currently, she complains of malaise and mild breathlessness. The mother noted that her daughter has been sluggish for the last 3 days. Her vital signs are blood pressure 100/60 mm mercury, heart rate 90 per minute, respiratory rate 22 per minute, and temperature is 38.8 degrees Celsius, 101.8 degrees Fahrenheit. On physical examination, the patient has slightly enlarged submandibular lymph nodes bilaterally and oropharyngeal erythema. On auscultation, there are diminished vesicular breath sounds with a few respiratory crackles over the lower lobe of the left lung. Which of the following factors requires delaying the patient's vaccination? Pause and attempt the question before you continue to view the explanation. Correct answer, D. Explanation: moderate to severe acute illness with or without fever should delay administration of any vaccine to prevent confusing disease symptoms with possible adverse vaccine effects. In contrast, acute mild illness with or without temperature elevation is not considered to be a precaution, and vaccines can be safely and efficaciously given to patients presenting with such illnesses. Fever and diminished vesicular breath sounds with crackles over the left lower lobe suggest pneumonia in this patient. A chest X-ray should be obtained to confirm the diagnosis, and empiric antibiotics should be administered in the case of a suggestive radiograph. The vaccination can be reconsidered after objective recovery. You will also find more explanation in the description of the video and also a link to Lecturio for more questions. Do not forget to like, subscribe and click the bell notification button for your daily dose of high-yield concepts. Thank you.